It's Tuesday, it's 12:15 and we're live in Westminster. Joining me today, the Conservative MP Laura Farris, the shadow leader of the Commons, Thangam Debbonaire, the broadcaster and author of How to Stop Fascism, Paul Mason, and Annabel Denham from the free market think tank, the Institute of Economic Affairs. Remember this?
We will fix the crisis in social care once and for all with a clear plan we have prepared.
Today, more than 2 years later, we will finally see that plan.
That nettle has to be grasped, and this Prime Minister will not shirk that responsibility.
This morning, Boris Johnson has been persuading the Cabinet to sign on the dotted line. But as he prepares to shred at least one manifesto pledge, not everyone's convinced.
I'm not going to vote for it because I don't think it's the right thing to do.
There's been no consultation, there's been no cross-party working.
The Prime Minister is due to address MPs imminently. We'll be there live and with all the reaction. Welcome. So we are expecting that statement from Boris Johnson on his plan of how to fix the care system in England in around 15 minutes' time in the Commons. As I say, we'll bring you that live. But let's start by looking at a couple of the morning's newspapers and their reaction to what is going to be announced. Two different viewpoints. Here in the Daily Express, the headline is Boris sticks to his guns. My government will not duck the tough decisions. But this is how it actually looks in the Sun's Leader article, reflecting some of the anger on the Tory benches. It says Boris Johnson will pay the price at the ballot box if he believes he can break his manifesto promises around not raising taxes. Annabel, do you think, broadly speaking, this policy or plan will make or break Boris Johnson politically?
I think it will definitely hurt him politically. No tax promise that he makes will ever again be credible. And let's not forget, Jo, this government has already announced a stealth rise in income tax by freezing the personal allowance. However, I don't think it will break him. At the moment, the public are unfortunately quite understanding that tax rises may be introduced to foot the COVID bill, but there will certainly be pressure on him to deliver because people are going to want to see that that money is not going to nothing.
As you know, Paul, successive governments have tried and failed to actually reform the social care system, find a way of trying to protect the most vulnerable and how to pay for it. So do you think it could be a legacy moment for Boris Johnson? Is this one of the things domestically he could be remembered for?
Only if we see the end of the kind of orthodoxy that, taxes must not be used to redistribute wealth. Taxes cannot be used to improve the lot of poor and ordinary people. That's why we've got the right wing of the Conservative Party screaming about this. It's not about the inequity, it's about the idea of taking more, whether it's tax or NI. It would be great if we bury that orthodoxy where it belongs.
Laura, do you think this is a big political gamble?
I don't think it's a big political gamble. I think funding and reforming social care was always going to involve really, really difficult choices. And that's the reason why, for the last 24 years since Tony Blair first pledged to do it, no Prime Minister has ever done it, because it was always going to involve difficult decisions that risk making them unpopular. But I think that the public mood is such that there is now probably, as one of the priority issues, together with proper funding of the NHS, a real deep desire to see this issue resolved, even if that involves difficult choices.
Thangam, when all is said and done, are you worried this could actually play quite well for Boris Johnson politically?
Well, so far it doesn't actually look like a plan. It looks like a tax rise. And a tax rise is, let's face it, it is a manifesto broken promise. And that's not the only one. And we've had 11 years of successive Tory governments ducking difficult decisions. Boris Johnson actually came into office 2 years, 1 month and 14 days ago, saying on the steps of Downing Street, as you showed, that he had a plan. There's been no evidence of an actual plan. And even what's trailed doesn't look like a plan. As I said, it looks like a tax. It doesn't even look like the Cabinet's actually discussed it. So I'm not really sure that this is going to be a legacy moment, so much as people realising that there's not many promises that this Prime Minister makes that he's not willing to rip up if it suits him.
All right, well, let's catch up with the BBC's political editor, Laura Kuenssberg. Laura, what do we know at this point, and what are we expecting to hear that we don't know in a few moments' time?
OK, we know a lot. We know that there will be a national insurance rise to be branded as a health and social care levy of 1.25%, that increase, which will be paid by millions of workers and businesses. That will go towards a big amount of cash for the health service and for social care. One of the really important things that we don't know yet, and there is a long list, so forgive me, is how that money will be moved from the NHS to social care over the years. And really importantly, how much money is social care going to get up front at the very beginning of all of this? That's a really important question mark. We also don't know how the money, which is, as Thangam was saying, a tax rise, how is that going to be ring-fenced? Now, I've been told it will be legally protected in order to only be spent on health and social care. But we're going to have to take a really careful look at about how that's actually going to work in practice. And another huge question mark, forget the money for a minute, how is the quality of care actually going to be addressed? How are the changes to the model in England? And remember, the money is UK-wide and there will be extra cash for Wales, Scotland and Northern Ireland, but the changes to the system will be focused on England only. And at the moment, I have to say, there's a bit of a mystery over to the kind of reform to the system the government actually wants to see, beyond the last thing we know, which will make a difference to many of our viewers, I'm sure, that there will be a cap, maybe of around £80,000 set on how much any one individual would have to pay towards care costs over their lifetime, and a new level at the bottom under which people would be funded by their local council.
Oh, Laura Kuenssberg, thank you very much. Laura, Farris in the studio. How will you sell this on the doorstep? Can you sell it on the doorstep?
Well, look, I think that any kind of tax rise is difficult. It looks as if it's going to come out of national insurance, and you know, I think that is the fairest way to do it. It is less than if it directly hit income tax. I have to say I would be supportive if working pensioners were included in that. When we previously, or when Theresa May's government previously attempted some sort of raising funds through some sort of taxation on property, a tax on wealth, that was derided as the dementia tax by the Labour Party. This has been derided too. I have to say, as night follows day, it was inevitable that we were going to get criticised. Laura's quite right. We need to wait for the architecture, but what I'm expecting to see is an immediate injection of funds into social care. I know how cash-strapped local councils are in terms of staff wages, in terms of recruiting and retaining high-quality people, and removing that sort of element of postcode lottery so that people have certainty as they enter old age without any real knowledge about what may become of their health, that they have a standardised level of care that is offered to them through a central government system with a finite cap on what they might be exposed to at the end of all that.
All right, well, let's welcome Jake Berry, Conservative MP for Rossendale and Darwen. He's a former minister in Boris Johnson's government and now chairs the Northern Research Group of Tory MPs. Why don't you like the plans?
Well, first of all, I don't know what I don't know, so I haven't seen the plans yet. But Northern colleagues who I've been speaking to have expressed concern about the use of national insurance as a means of raising some or all of this money. And that's really for three reasons. Many economies across the North have high unemployment, lower wages and low property values. Taking each of those in turn, a jobs tax is a huge disincentive for businesses to create new jobs in your area. That's the first concern. The second concern is those on lower wages pay a much bigger proportion of their income in national insurance than people on very high wages. And the third area of concern, and we look forward to looking at the Prime Minister's plans, is £80,000 as a cap in many areas, including Rossendale and Darwen, where I have the privilege of representing, may equate to up to 80% of your property value, while in other areas like London, for example, it may be less than 10%. So people going to work across the north of England in low-wage jobs will be paying into a system more than people who have higher wages, respectively, and they will ultimately end up getting less out of it. And although I wait to see the plans, it's hard to see how that can be the right solution across the Red Wall.
Right. Do you share those concerns, Laura?
Well, look, I'm listening carefully to what Jake says, and obviously we don't know what's in the Prime Minister's announcement yet. But
on the basis of what we know, and we think we know, that's true, isn't it, what he said?
Well, but I think that does slightly misinterpret the fact that if you're on a lower wage, your national insurance contribution is much lower. For example, somebody who's earning sort of £15,000 will pay about 10% of what somebody on £100,000 would pay. So that is a proportionate increase according to the level of income. I think another thing that has been a little bit sort of, I mean, I've read this kind of last night coming out of the Northern Research Group, that it was asking sort of workers in the north to pay for rich old pensioners in the south. And I'd like to correct that narrative too, if I may, in that I dislike that generational element.
Well, you may dislike it, but it is true, isn't it?
But it's also the case that social care doesn't just pay for elderly people. There are plenty of children who are paid for by social care. A third of my local authority's budget goes to working age people, social care, people with severe learning disabilities and supported living. So this is a structural issue which affects every age group and every demographic in society, and we should talk about it in that way.
Right, well, Jake, we've been watching you as you listen there to Laura. Would you be happy with a different kind of tax to pay for the reforms that are talked about? Income tax, a wealth tax, for example?
Look, we've made some suggestions, but just to very quickly pick up on national insurance. The marginal rate of national insurance is 2% above earnings just over £50,000. So the difference between someone earning £50,000 or £100,000 is just a £1,000 difference in terms of national insurance. So your national insurance bill would go from around £6,000 if you earn 50 grand to £7,000 for someone who earns £100,000. It's a regressive tax, which is why we absolutely want to tackle this issue. We congratulate the Prime Minister and his government for grasping the nettle, as Nadim Zahawi said.
Right.
We think a fairer and more equitable way would be to look at income tax, which is more evenly spread. In fact, it's paid by everyone. Of course, national insurance isn't paid by people in receipt of a pension. Lots of people in receipt of a pension have relatively generous pensions if they've worked in the public sector. It seems to be right that they should pay as well. And finally, the other thing we would be grateful if the government looked at is some sort of, Amazon tax or online sales tax on tech giants who have made a killing over this COVID period into tens of billions of pounds to support our NHS, which is desperately in need of cash, which I think everyone accepts.
You've clearly set out your concerns. Will you vote against the plans when the vote comes?
Well, I started this interview by saying I can't know what I don't know.
No, but on the basis of this discussion, would you vote against it if that's what actually turns out to be the case?
I don't come on that often, but I did think it was traditional that you asked the question, let me answer it. So please do let me answer it.
Go on then.
I can't know what I don't know. It appears that some of our arguments have already been listened to. I've seen a message from Laura Kuenssberg, which has just gone out on the wires, saying in fact the government is going to try and address this through dividend tax and things like that. We want to support the government. We want to support their plan to tackle this huge national challenge of crisis of social care. If we can find a way to do it, we will. But we don't think national insurance on its own, or I don't think national insurance on its own is the way to do it. So let's look at the whole package and I'll make a decision.
Just to push you a little further, if it is wholly or pretty well wholly on national insurance contributions, a tax or an increase on that, will you vote against it?
Well, you're not going to draw me because I simply haven't seen the package. And then the other thing is, who knows when the vote will be? It may even be as early as Thursday here. But there is a long way to go in terms of trying to make sure that the government does this in the most fair and equitable way, which will be exactly what the Prime Minister wants to do. So I hope he's listening to the arguments.
Thangam, Keir Starmer indicated to the Daily Mirror yesterday that Labour won't back the plan to increase national insurance contributions to pay for reform. What's Labour's alternative?
Well, we know there will need to be some form of fundraising that has to happen. That will have to come from taxes somewhere.
Right.
And at the moment, what we do know is that, unfortunately, national insurance is a regressive form of gathering income. So we don't think that's the right way to go.
So which tax would you use?
And I think we have to look at all of the alternatives. But what we haven't discussed so far is what it's going to pay for. Until we decide what it's going to pay for, we don't know what.
That doesn't stop you saying where you would actually see a fairer system of raising the money. And Labour does, as the opposition on this hugely important issue, and decades we've discussed it and not come up with a solution. What would be fairer?
Well, what will be fairer will be deciding what the actual plan is. And
in terms of fundraising,
what it's going to pay for. Is it going to pay for more workforce? Is it going to pay for training?
So are you saying you would decide on a different tax-raising measure depending on precisely what it would pay for? Or do you have in mind, as people would expect, where you would raise that amount of money, 10 to 12 billion pounds, where will you get that money from to pay for any reform?
It depends how much this government ruins the economy in the next 2 years before we get to a general election. And nobody would expect us to take a tough decision on how we're going to spend money that may not even be there in 2 years' time if this government carries on running the economy.
Paul, is that good enough from Labour not to have a firm idea of what they would do as an alternative if they don't like national insurance contributions being used?
Well, both myself and Thangam campaigned in 2019, which is not that long ago, for a very clear policy, which is for a national care service, personal care free at the point of need, paid for by capital gains tax, by raising capital gains tax to the same rate as income tax. I think that, back of the envelope, that would probably raise about 9 to 10 billion. You could raise more by doing a little bit extra on the financial transaction tax, on the tax on share and bond dealings. If it's going to be hypothecated, as it sounds like it is, then I think that solves the political problem, because, of course, Labour should want to do more redistribution, more tax, more spending, more borrowing. And, of course, we're not expecting them to say everything they're going to do. But the principle's clear in what Starmer said. He wants it to be spread across all forms of income. So that includes corporation tax, that includes capital gains, it should include financial transaction tax.
Well, let's hear Thangam. So Paul said
it is quite extraordinary that Paul expects us to commit the 2024 manifesto to the 2019 manifesto. Jeremy Corbyn didn't commit his manifesto in 2015. We will have to adapt to different circumstances. There will have to be some form of tax raising powers that allow us to pay for the range of things which haven't been spelt out by this Prime Minister. And I'm not committing the Labour Party when we don't know what the current government's going to do to the economy over the next 2 years. I think we do need to look at what the workforce issues are, what the different needs of people are over the next years, and how we're going to prevent people from needing to go into the more expensive forms of care, but stay in their homes that they would really like to do.
Or is that ducking the big principles there, Paul, that you're talking about?
But the principles are clear, and Labour set them out. It's fairly clear subtextually that they will go for a wealth tax and a tax on profits and capital gains. They have to, and of course they have to do a lot of other things. But what frustrates me is that, no, this was actually policy. The reason why I'm harking back to it is that it was a policy democratically decided by our party. And as far as I know, it's still the policy. So I'd like to see the Labour front bench, of course, hold its fire until we see what this proposal is. It sounds like Johnson is being pushed further by his own backbench than he wanted to go. But the principle is clear. We raise taxes on the richest, not on people earning 15 to 20k in northern towns like the one I come from.
Right. Just before I go to Annabelle and the statement, yes or no to that broadly is the principle?
Well, we always said, and we continue to say, that those with the broadest shoulders should take the greatest share of the burden. And of course, a national insurance plan does the exact opposite of that.
Annabelle, how much trouble do you think Boris Johnson will be with people on his side of the political divide?
Well, as I said at the start, I do think that the public are, broadly speaking, unfortunately, quite supportive of tax rises to pay for COVID. I think one benefit to the debate that we're having now, Jo, is that people are realising that national insurance is a con. People have historically supported it because there's this illusion that they're building up some entitlement over time. The money's placed in a pot, it goes towards funding their care as they get older, or perhaps develop chronic illnesses. It doesn't. There's no such thing as a national insurance fund, and we're helpfully debunking that myth today. To some of the points that are raised about these catchy sound bites about people with the broadest shoulders bearing the most burden. I mean, we are at or close to our taxable limit. The 5-year average tax burden in the UK is at a 70-year high. What this means is that there's very little more that can be squeezed out of the private sector. In fact, in the case of some taxes, we're already on the wrong side of the Laffer curve. So I'd rather see us simplify or replace a range of taxes, reduce the overall burden of taxation, and eliminate a number of harmful distortions. But to some of the points that Thangam has made as well, we're not hearing much about what this is actually going to achieve. There's a lot of talk about grasping nettles and clear plans, but how is this actually going to improve the system?
All right, I'm keeping an eye on the Commons. We may only have a few minutes. You were shaking your head there, Paul, and then I'll come to you, Laura.
Only about the Laffer curve. I mean, the idea, the Laffer curve is just a fictitious thing made up by an economist that many other economists simply disagree with. What we're talking about here...
Paul, I'm so sorry. We're going to have to interrupt you on the Laffer curve. Here's the Prime Minister.
Social care. Our National Health Service is the pride of our whole United Kingdom, and all the more so after it has been there for us during the worst pandemic in a century, treating almost 500,000 patients, administering more than 88 million vaccines, and saving countless lives. But the inevitable consequence of this necessary and extraordinary action is that COVID has placed massive pressures on our NHS. As we stayed at home to protect the NHS, thousands of people did not come forward for the treatment they needed. Like those who suffered from COVID, these are all people we know. Your aunt, who needs a new hip. Your neighbour, who has problems with their heart and needs a pacemaker. Your friend at work, who thinks that they should get that lump or cough checked out. So we must now help the NHS to recover, to be able to provide this much-needed care to our constituents and the people we love, and we must provide the funding to do so now. We not only have to pay for the operations and treatments that people decided not to have during the pandemic, we need to pay good wages for the 50,000 nurses who will enable that treatment and who can help us tackle waiting lists that could otherwise expand to 13 million over the next few years. We need to now go beyond the record funding we have already provided, and we need to go further than the 48 hospitals and 50 million more GP appointments that are already in our plan. So today we are beginning the biggest catch-up programme in NHS history, tackling the COVID backlogs by increasing hospital capacity to 110% and enabling 9 million more appointments, scans and operations. As a result, while waiting lists will get worse before they get better, the NHS will aim to be treating around 30% more elective patients by 2024-2025 than before COVID. And we will also fix the long-term problems of health and social care, that the party opposite certainly failed to tackle, Mr. Speaker, and that have been so cruelly exposed by COVID. But having spent £407 billion or more to support lives and livelihoods throughout the pandemic, from furlough to vaccines, it would be wrong for me to say that we can pay for this recovery without taking the difficult but responsible decisions about how we finance it. As a permanent additional investment in health and social care, it would be irresponsible to meet the costs from higher borrowing and higher debt. From next April, we will create a new UK-wide 1.25% health and social care levy on earned income hypothecated in law to health and social care, with dividend rates increasing by the same amount. This will raise almost £36 billion over the next 3 years, with money from the levy going directly to health and social care across the whole of our United Kingdom. This won't be pay awards for middle management. It will go straight to the front line at a time when we need to get more out of our health and social care system than ever before. And it will enable radical innovation to improve the speed and quality of care, including better screening equipment to diagnose serious diseases such as cancer more quickly, designated surgical facilities so non-urgent patients are no longer competing with A&E, faster GP access to specialists so you don't have to wait months to see someone in hospital to find out whether something is wrong, and new digital technology so doctors can monitor patients remotely in their homes. And we will do all this in a way that is right and reasonable and fair. Mr. Speaker, some will ask why we don't increase income tax or capital gains tax instead. But income tax isn't paid by businesses, so the whole burden would fall on individuals, roughly doubling the amount that the basic taxpayer could expect to pay. And the total revenue, Mr. Speaker, from capital gains tax amounts to less than £9 billion this year. Instead, our new levy will share the cost between individuals and businesses, and everyone will contribute according to their means, including those above state pension age. So those who earn more will pay more. And because we are also increasing dividends tax rate, we will be asking better off business owners and investors to make a fair contribution too. In fact, the highest earning 14% will pay around half the revenues. No one earning less than £9,568 will pay a penny. And the majority of small businesses will be protected, with 40% of all businesses paying nothing at all. And while Scotland, Wales and Northern Ireland have their own system, we will direct money raised through the levy to their health and social care services. So in total, Scotland, Wales and Northern Ireland will benefit from an extra £2.2 billion a year, Mr. Speaker. And as this is about 15% more than they will contribute through the levy, it will create a union dividend worth £300 million, Mr. Speaker. Worth £300 million. But, Mr. Speaker, we can't just put more money in. We need reform and change. We need to build back better from COVID. When the COVID storm broke last year, there were 30,000 hospital beds in England occupied by people who could have been better cared for elsewhere and who wanted to be better cared elsewhere. That's 30,000, Mr. Speaker, out of 100,000 hospital beds in our NHS, costing billions every night and unable to be used by people needing cancer care, needing hip operations, making it harder than ever to deal with the growing backlog in our NHS. Too often, people were in hospital beds because they or their relatives were worried about the cost of care in a residential home. And that same fear kept many others at home without any care at all. This anxiety affects millions of people up and down the country. The fear that a condition like dementia, one of nature's bolts from the blue, could lead to the total liquidation of their assets, their lifetime savings, their home, the loss of everything that they might otherwise pass on to their children, however great or small. While sufferers from other diseases who have to be in hospital for the majority of their treatment have their care paid for in full by the NHS. Governments have ducked this problem for decades. Parliament even voted to fix it. And yet that 30,000 figure is an indictment of the failure to do so. And so, Mr. Speaker, there can be no more dither and delay. We know we can't rely solely on private insurance because demand would be too low for insurers to offer an affordable price. And a universal system of free care for all would be needlessly expensive when those who can afford to contribute to their care should do so. Instead, the state should target its help at protecting people against the catastrophic fear of losing everything to pay for the cost of their care. And that is what this government will do. We are setting a limit on what people can be asked to pay. And we will be working with the financial services industry to innovate and help people to insure themselves against expenditure up to that limit. Wherever you live, whatever your age, your income or your condition, from October 2023, no one starting care will pay more than £86,000 over their lifetime, and no one with assets less than £20,000 will have to make any contribution from their savings or housing wealth. That's up from £14,000 today. Meanwhile, anyone with assets between £20,000 and £100,000 will be eligible for some means-tested support. And this new upper capital limit of £100,000 is more than 4 times the current limit, helping many more people with modest assets. And as we fix this long-term, long-standing problem in social care, we will also address the fears that many have about how their loved ones will be looked after by investing in the quality of care, in carers themselves, and by integrating health and care in England. So older people and disabled people are cared for better, with dignity and in the right setting. My Right Honourable Friend, the Secretary of State for Health and Social Care, will be bringing forward a white paper on integration later this year. Mr. Speaker, you can't fix the COVID backlogs without giving the NHS the money it needs. And you can't fix the NHS without fixing social care. You can't fix social care without removing the fear of losing everything to pay for social care. And you can't fix health and social care without long-term reform. The plan that this government is setting out today, the plan I'm setting out today, will fix all of those problems together. And of course, no Conservative government, Mr. Speaker, ever wants to raise taxes. And I will be honest with the House, I accept that this breaks a manifesto commitment, which is not something I do lightly, but a global pandemic was in no one's manifesto, Mr. Speaker. And I think the people of this country understand that in their bones, and they can see the enormous steps this government and the Treasury have taken. And after all the extraordinary actions that have been taken to protect lives and livelihoods over the last 18 months, this is the right, the reasonable and the fair approach, enabling our amazing NHS to come back strongly from the crisis, tackling the COVID backlogs, funding our nurses, making sure people get the care and treatment they need in the right place at the right time, and ending a chronic and unfair anxiety for millions of people and their families up and down this country. And I commend this statement to the House.
I now call the Leader of the Opposition.
That is the end of Boris Johnson's statement, long awaited, it seems, since he announced a plan would be made on social care 2 years ago. But now we've had it confirmed. All the briefing, it turns out to be broadly true. A 1.25% levy on both employees and employers' national insurance contributions and dividends to fund the post-pandemic catch-up and social care reforms. We also learned that it will be hypothetical. In other words, it will be separated out. You'll be able to see it on your tax bills. It will be levied, that tax, from April 2022. He also announced that there would be a cap on lifetime costs. Again, we had sort of estimated that to be between 80 and 88,000. It is, in fact, £86,000, that you won't have to pay more than that over your lifetime for care. Those with assets less than £20,000 won't pay anything at all, and those with assets between £20,000 and £100,000 will get some help from the state. He did end that statement, also acknowledging that it is a break with a very clear manifesto promise and guarantee in 2019 not to raise the main headline rates of tax. It was a signed pledge by the Prime Minister to say they wouldn't do that. Conservatives don't like to raise taxes. That's exactly what he's done. Laura, how difficult is that? He has broken a guarantee that he signed on a pledge not to raise this kind of tax, national insurance, and he's done precisely that.
He was right to say, though, that the pledge not to raise national insurance was in the manifesto. The COVID spend was not in the manifesto. When a disaster strikes, the British people have a reasonable expectation that the government will protect them. The government did protect them to the tune of £400 billion. Therefore, a number of other major spending schemes had to be looked at in a different light. Otherwise, Jo, you know this, we would be saddling future generations with the cost of our borrowing if indeed we were going to tackle social care. One of the things that was important about that announcement was the architecture of the funding, touching on the comments that we were making in the early part of this show about fairness, about not just hitting individuals, but employers. Also on dividends, a small point that's easy to overlook, which is those who have shares in companies, something I'm sure Paul would approve of. It's only a small number of people, but the wealth can be considerable. Protecting those on the lowest incomes, protecting those with the lowest number of assets, a hypothecated tax structure, a graduated liability. All of this engages fundamental principles of fairness. Yes, it's a tough decision, Jo, but you heard respectfully, when Thangam gave her answer earlier, Labour have no ideas on this whatsoever. They can't tell you how they'd fund it.
Just to say that Keir Starmer, the Labour leader, is now also standing up and responding to Boris Johnson. Thangam, we're going to bring some of what he says in a few minutes' time. But broadly, I know you're not happy about the way this money is being raised, Thangam. Do you accept, though, that it does bring some clarity, that it does bring some reassurance to many people about the sort of costs they might have to incur to pay for their care, and delivers a significant reform of the social care system in England?
When constituents talk to me about their worries about care, They talk about cost, but they also talk about where's the carer going to, you know, who's going to employ the carer. And often it will be the council who has provided that service or has negotiated that service. Over the last 10 years, council funding has been run down. I didn't hear anything about how it's going to help with councils who have been providing a lot of that home care. It didn't talk about the century of ageing we're in at the moment, where we are going to get older and we will have more long-term chronic illnesses. It didn't talk about how we're going to employ people and give them that career development and that decent pay. So there's so many unanswered questions.
There are, but on the broad principle, do you accept that this might be the first time, well, it is the first time that somebody is going to try and grip this system, even if you don't like the way exactly it's been presented?
Well, they've had 11 years to read the Dilnot report over and over again, so it's about time that somebody realised that Andrew Dilnot's been making this point for some time about a cap, and that is important. However, it still doesn't answer the question of where are these carers going to be? Where are they going to come from? Who's going to employ them? Who's going to train them? Are they going to have good job satisfaction? How are we going to bring artificial intelligence into this and the digital and tech contributions to the providing a care service? All those things that we ought to have been in a plan, and all we've got is a tax. It's not a plan.
I think that will come, some of it, won't it, in the Health and Social Care Bill. Annabelle, listening to Boris Johnson deliver that in quite a hurry, I thought he was, and then acknowledging, obviously, the break with the manifesto pledge. Broadly, do you think it is what you either feared or it's better than you expected?
I think it's about exactly what I feared. I mean, look, it is absurd to have the working age population foot the social care bill while those over the state pension age with substantial incomes and assets are not contributing. To the point about businesses also paying, let's take employer national insurance. This is essentially accrued payroll tax that discourages employment at the margin and that will translate into lower wages down the line. I really struggle to see how this is helping those who are on lower incomes. And while Boris Johnson is wedded to the Dilnot proposals from 2011, they won't add a single bed to the care home system. They aim to protect the sick and the elderly from the threat of having to sell their home to cover their care. And in many cases, this translates into a subsidy for the rich. So I look forward to reading a bit more detail later on today or in the coming days and weeks. But like Thangam, I have concerns.
Right, a jobs tax, Laura.
I don't agree with the idea that it takes the elderly people out of it, because it looks specifically at what their assets are before determining how much they can contribute. The Prime Minister addressed the problem of a universal healthcare payment, which I think is what Paul advocated, and he said it would be needlessly expensive for the vast majority of people. Of course, any tax has some effect on people's incomes. I can't deny that, a tax on national insurance. But the simple point is this. One of the things that has always been so troubling about care, particularly about dementia, which I think he said hits you like a bolt of lightning, is that it creates a disparity which is profoundly unfair between the person who dies in hospital from cancer and the person who dies from dementia in a care home. And the only way of doing that is to standardise it in some way. And I think that was a fair and a very positive solution to be announced to what was always going to be an incredibly complex problem.
Paul?
If I make
I'm sorry, yeah, Paul, I'll just let Annabelle respond and then I'll come to you.
I mean, it simply isn't the case that this was the last resort or this was the only option that's on the table. You could have had universal care with some kind of voluntary supplement, and that would have mitigated against the dementia lottery element.
Paul?
In Newbury, Laura's constituency, the average house sells for about 400,000 and it's a semi. In Lee, where I come from, you can pick a house up for 30k off an auction, 80k. A terraced house. The problem is when you have a cap that arbitrarily says everybody poor loses most of their wealth, and rich people, elderly rich people in southern England, or even not elderly rich people in southern England, don't lose a big proportion of their wealth. It's always inequitable. But we have to look at the small print, because what's worrying me now, in addition to the NI raise, is the fact that the Prime Minister at the end said there's going to be integration of health and social care. Well, it's a great principle, but the integration that the right wing of the Conservative wants is the integration of the basically the user pays principle and the it eats your savings principle. That's what I'm now worried about, that we extend this principle into the NHS.
When Theresa Theresa May proposed a tax on property prices in 2017, you were one of the people who decried it as a dementia tax. You were very critical of it in the 2017 general election. So I think to sort of criticise people in Newbury for the price of their house or say that the Prime Minister should have taxed property
I'm
is
saying
absolutely...
that they have a better deal. They are getting a better deal from this than the people in the north of England and indeed parts of Scotland.
You were highly critical when a property-related tax was proposed, so it is a bit rich to hear your criticism of it now.
Capital gains, financial transaction tax and wealth taxes are the way we should be paying for this.
Right, and when it comes to criticism, people also criticise Gordon Brown, of course, Laura, the former Labour Prime Minister, when he had and introduced, or he tried to, what was then dubbed a death tax. So we do admit that all sides here have criticised the opposition or the government for trying to bring forward plans on social care. Thangam, in terms of what you get in that reassurance, at the moment people face unlimited costs, can face unlimited costs for their care. Making that limited, does that not psychologically make a difference? It's £86,000. You won't pay more than that over your lifetime.
Well, it will vary depending on where you are in the country, of course. But yes, of course, it provides a certain amount of clarity. But it's still, I'm sorry to keep coming back to it, it still doesn't tell people where they're going to get the care from. Are they going to get a care appointment that lasts for longer than 20 minutes? Will they get the same care every day? Will local authorities, who have frankly been subsidising public services to a huge extent over the last few years with the cuts that successive Tory governments have put in place, will they get any of that hypothecated levy? We still don't know that. There's a lot more detail we need yet.
Right. One of the things that Boris Johnson also said in the election campaign and afterwards is that people shouldn't have to sell their homes to pay for their care. You do know that some people will have to sell their homes, won't they, under these proposals? Because if you have a property over £100,000 and you don't have any other savings, you'll have to sell your home potentially to pay for anything over £80,000.
Well, look, I don't know the substance of that, but I accept in principle what you're saying. I think it's still right, though, to observe that it is only going to be the more wealthy who would have assets of that size. And the reality is that, you would only expect those with the broadest shoulders to pay up to £86,000. It's still a big chunk of a care cost. And I think that in terms of the overall structure of fairness, it has to be the right answer.
Sorry to jump in. We're going to hear now from Keir Starmer, the Labour leader.
The pretence that the Prime Minister is only here because of the pandemic is not going to wash. He's putting a sticking plaster over gaping wounds which his party inflicted. He made that commitment on social care before the pandemic, and he said he would pay for it without raising taxes before the pandemic. The blunt and uncomfortable truth is that under the Prime Minister's plans, the quality of care received will not improve. There's no plan for that. People will still go without the care that they need. There's no plan for that. Unpaid family carers will still be pushed to breaking point. There's no plan for that. Working-age adults with disabilities will have no more control under their lives. There's no plan for that. Pay and conditions will not improve for care workers. There's no plan for that.
Right, Thangam, do you think you'll vote against the plans?
Well, Keir's just spelt out a long list of things that there isn't a plan for. So, I mean, we'll be poring over this.
Sure.
I believe we will be voting later on this week. That's what it looks like at the moment. We'll need to go through the detail. But so far, from what Keir's saying, it doesn't look like there's much in there for us to support. This is a broken promise on broken promise on broken promise. And even the Prime Minister said that COVID exposed what was already there because of 11 years of Tory governments cutting and cutting and cutting. That was what was there before. It's no use using COVID as cover. You can't keep doing that indefinitely.
Laura, how difficult will it be to get this plan through when we've heard from your colleagues like Jake Berry, who are very unhappy?
Well, I think Jake had some concerns, but he didn't say that he was going to vote against it. I think it's going to pass the Commons. I think it will have broad support from the party, and I think it will be welcome overall.
Well, that's all we have time for. Thank you to all of my guests today for joining me. I'll be back tomorrow at 11:15 with Prime Minister's questions. It should be good. Join me.